Good afternoon, everyone. Today is Thursday, May 7th, 2020. My name is Lenine Livingston, and I'm the Public Information Officer for the Fairbanks North Star Borough, and I'm also the Joint Information Systems Coordinator for the Interior Alaska Unified Command. We'd like to welcome everyone to this afternoon's press conference. Here is the order of our speakers today. We'll have our incident commanders, Mr. Kyle Wright and Mr. Clint Brooks will speak first. They will be followed by Elizabeth Burton, Regional Health Nurse from the Fairbanks Regional Public Health Office, followed by Foundation Health Partners. We have Dr. Laura Bruner and Dr. Michelle Nace. We'll be followed by City of Fairbanks Mayor Jim Matherly. And then our community partner this afternoon will be Mr. Michael Sanders from the Housing and Homeless Coalition, City of Fairbanks. So at this time, I'd like to go ahead and turn it over to our incident commanders, Kyle Wright and Clint Brooks. Gentlemen.
Thank you, Lenine. Good afternoon. This is Clint Brooks. I kind of wanted to touch base on some of the numbers and some of the issues that Unified Command have been talking about this week. So currently, the borough has had a cumulative total of 83 cases, but 68 of those have recovered. And that's leaving us with 13 active cases in the borough, which is really good news. So FMH now has been 27 days without a positive COVID patient, which is another good indicator that all the efforts that we're doing as a community are working. We're really controlling the spread of this disease. That said, we did have an individual from Tok that was in and about and around our community this week without adhering to the masking request and without doing social distancing, and then was found out to be positive for COVID. So that's a reminder of how important it is to wear a mask, to control the source, and not spread the disease. We were successful in moving our drive-through testing from down on 10th and Noble to FMH campus on the south end of campus off the end of 19th Avenue is our new drive-through location, and that's been in operation since Monday and has been successfully transferred to that location. Last night, the governor announced his Reopening Alaska Responsibly Phase 2 plan. We've been waiting for that to come out in a written document so we can review the requirements for that. We have yet to see that document, so we're awaiting with that, anticipating the arrival of that this afternoon so we can understand the impacts and the requirements for going into phase 2. Kyle, do you have anything to add? I guess not. Lenine, back over to you.
That's all right. Thank you very much, sir. Now I'd like to go ahead and turn it over to Elizabeth Burton. She's a registered nurse. She is the regional nurse manager here in Fairbanks at the Fairbanks Regional Health Center. So Elizabeth, we'll turn it over to you.
Hi, thank you. Good afternoon. I wanted to touch briefly on the new COVID positive case that we heard about earlier this week in Tok. And I wanted to just talk about it and highlight the partnership that we have with some other community resources that help make things go smoothly in a situation like this. When the affected individual was diagnosed several days ago, we received information from the Tanana Chiefs Conference, Tok clinic staff, fairly shortly after the diagnosis was made. And our public health nurses, we have about 100 of them around the state, were immediately able to respond to the new case and contact the affected individual, do some education about the importance of staying home, the importance of following the travel expectations, that when you return from outside that you would honor the 14-day quarantine mandate, that it's important to stay home during the course of your illness. And we had a very productive conversations with some of the staff at the Tote Clinic, and we are jointly continuing to support that individual. Part of the public health nurse role in this situation is once we've had a conversation with this person and talk with them about how they're feeling, how they're doing, and following up on all those requests to stay home and things like that, is that we continue talking with that person daily to make sure that they're not becoming really sick and requiring more immediate medical care. We're also talking with them to help remind them about what the expectations are during their course of illness that they need to follow so that they don't infect other people in their community, and that's been going really well. I just wanted to use this opportunity to follow up a little bit on what Mr. Brooks mentioned as far as making sure that we're all doing our part to reduce the spread of COVID. We've seen a very low case count, especially in the interior here recently, and I think we can all say that that's due to local Alaskans here that are following the expectations to remember social distancing is really important. Hand washing is really important. And so I just want to remind folks a little bit about the hand washing. When should you wash your hands? I've heard so many people say, gosh, my hands are getting really dry, but it is helping us to reduce the spread. So if you're going in or out of a building, it's a good time to wash your hands. If you use an elevator or you went up and down a stairwell in a public building and you touch the elevator buttons or the handrail, good time to wash your hands. Before you eat, wash your hands. When you're using the restroom, really do a thorough job washing your hands. If you find yourself coughing, sneezing, or blowing your nose, that's really a great time to wash your hands. Try to, if you have time, to sneeze into your elbow instead of just sneezing outright. You should wash your hands for 20 seconds. Don't forget to wash the backs of your hands and in between your fingers. As far as the social distancing goes, we're asking people to remember that we are starting to slowly open up Alaska. We're going to see more and more people out and about. It's really important, even if you see a friend or a neighbor that you haven't seen for a while, please stay 6 feet apart. Remember to honor that 6-foot rule. When you're going into a public area, there are some businesses now that are making it mandatory that you come into their facility wearing a face mask. Even if it's not mandatory at the business you're traveling to, we recommend that you wear a face mask every time you're out in a public place like that. If you see someone coming out the door of a store, back up and let them go by and keep that 6-foot distance before you go past them and into the building. Once you're inside, get your shopping done, get your business done, go home, wash your hands. Remember, your face cloth is also contaminated when you're wearing it regularly, and it's important to put that into the laundry and clean it regularly. Also, if you're bringing items into your home, great idea to maybe wipe down the surfaces after you're done putting things away that you might have put grocery bags on or something like that. So we can all do our part, even though we're able to go out and see people a little bit more now, to keep the spread down by following these simple tips. So thanks for everything you're doing, Fairbanks.
Thank you, Elizabeth, very much. We appreciate that timely messaging about contact tracing and reminders about proper hand washing, et cetera. Now I'd like to go ahead and turn it over to Foundation Health Partners, and we have Dr. Laura Bruner and Dr. Michelle Nace to share information, please. Foundation Health.
Hi guys, good afternoon. Can you hear me okay?
Yes.
Perfect. So I just wanted to take a couple minutes to touch on testing for COVID-19. As you heard Elizabeth talk about and the recent cases, that it really remains one of our most important tools that we have to monitor and then to contain or to trace COVID-19 in our Fairbanks community and area. So I imagine that it will continue to change what types of tests we have, the availability, the turnaround time will continue as COVID-19 continues in our country. As Mr. Brooks mentioned, the FHP drive-up is up and running on the south end of FMH and remains open. Patients with a provider can order and schedule a test or with a provider order can schedule a test and come to the drive-through. The state mandates have put guidelines and requirements around testing prior to some procedures as well. And at FHP, we continue to partner with state labs and commercial labs to ensure access to ongoing testing supply. We would like to confirm that we have received about 150 rapid test kits in the last day or so, and we're hopeful that we will have some in-house testing capability starting in the next couple of days. However, this rapid testing capability will continue to remain very limited. It takes a certain number of kits to calibrate the machine and calibrate it every day. And so of those 150 kits, around 100 or so will be available for direct patient care in a month time period. We'll continue to work on trying to get more supplies and expand our supplies and availability, but it will remain limited. We'll continue to work with all of our vendors and suppliers to try to increase the capacity. To keep those 100 kits in perspective, to test all of our inpatients and pre-procedural patients, we would need many times that number of kits to do that testing in a rapid fashion. FHP Lab will continue to work on supplies and access, and I just want to be very clear that we continue to have adequate testing capability, and we want to test all patients even with mild symptoms. So patients with mild symptoms, to echo the state's message and the message that you've heard, we continue to absolutely have adequate supply to test those patients. We are excited to add rapid testing capability in a very limited supply as one more tool in our toolkit moving forward. That's all we have for today. I'll turn it back to Lenine.
Thank you very much. Now I'd like to go ahead and turn it over to City of Fairbanks Mayor Jim Matherly. Jim?
Thank you very much, Lenine. And thank you everyone for being here today. It's a beautiful day. And as the weather turns to more sunshine, more people are inevitably going to be outside. And what I'd like to remind Fairbanks, Elizabeth said it earlier really well. Since phase 2 is now coming into effect tomorrow, and we've been with phase 1 for a couple of weeks, our numbers are continuing to be low. And I would like to thank the folks of Fairbanks, the borough, everyone that's in the Fairbanks area who is practicing the social distancing, who is practicing masking up and keeping with it and being consistent are the reasons why. So as we continue to open up more places slowly, as you can see in the mandates, it's increasing by about 25% or more as far as numbers of people who can gather and do things. As long as we remain diligent in our wearing of our masks and our social distancing, the numbers will stay down and we will not see another spike. So to those businesses that are requiring masking, who are encouraging it, who are seating people separately as being recommended, I thank you completely. You are the strong ones in this entire prevention. In fact, you have all the power to do the right thing. And my hat's off to everybody who is. So I say, enjoy yourselves, be very careful, bring a mask with you, practice those issues that Elizabeth talked about earlier with washing things, washing your hands and staying on top of it. But I can't say enough good things about Fairbanks and how they've really stepped up and kept our numbers low. Thank you very much, Lean, for these fantastic press conferences.
Thank you, Mayor Matherly. We appreciate that. Now I'd like to go ahead and turn it over to one of our community partners, Michael Sanders. He's the Housing and Homeless Coordinator for the City of Fairbanks, who will give us some information. Mike?
Hi, Lenine. Thank you very much for giving me the opportunity to talk about some of the great work that our local agencies have been doing. It's been really impressive to watch them. They've been collaborating on this since early March. The various homeless shelters that we have, the Fairbanks Rescue Mission, the Center for Nonviolent Living, and the Door, they started planning back in early March when they saw what was happening in Seattle, and they've really been ahead of the curve up here, and I'm really grateful for all the work they've done. Shortly after they started planning, we started reaching out to a bigger and bigger group of social service providers, and we also brought in FMH and public health, and I can't say enough good things about all the great help that we've gotten from public health and and FMH. Carol Davila and Dr. Simon from FMH have been involved in this since day one, and they've been great for helping us get going. And Shelley and Ken, same thing with public health. They've been pretty amazing. We've been really fortunate here in Fairbanks. We haven't seen a lot of folks experiencing homelessness contracting COVID-19. In fact, the only case that we've had is somebody who tested positive in Anchorage, and then at the end of his isolation came up. We, from the very beginning, we didn't have to go out to to find another venue for our shelters. Our shelters are some of the largest in the state. The Fairbanks Rescue Mission, before even COVID-19 hit, they're already meeting the CDC guidelines for COVID-19. And since then, they have more than double the space between the bunks. And they have housed all their immunocompromised and elderly clients offsite. And really appreciative of all the great work they've done as well. Unfortunately, not everybody that is experiencing homelessness is participating in the shelters, though. At any given time in Fairbanks, we have about 50 folks that are living in encampments or on the streets. We do have 4 local programs that are devoted to building rapport with with the unsheltered individuals, and they've been incredibly busy the last few months. No Limits established a warming center way back in October, before we even knew that COVID was going to be a thing. And at one point, with all the shutdowns and everything, it was really the only place left in town for somebody to walk in and get warm, use the restroom, perform hygiene, etc. No Limits even allowed guests to stay, the warming center, to stay there at night free of charge without any barriers. No Limits did eventually need to have help, though, with implementing the social distancing constraints and procedures. They just didn't have enough space to serve everybody that they were serving at the warming center. So the Fairbanks Reentry Coalition opened up a second warming center at the J.P. Jones Center. And now that it's starting to get warmer out and things are starting to open up, both of these warming centers are starting to cut back on operations. They've seen a pretty steady decline in attendance lately, and they're going to start focusing back on to their regular operations. But at one point, when everything else was shut down, folks could still go into Stone Soup Cafe in the morning to get breakfast and lunch and use the restroom, etc. Then right after that, go to No Limits. Then right after that, go to the J.P. Jones Center. And to augment the work that they've been doing, the city of Fairbanks has also placed some portable latrines in the Golden Heart Plaza and is looking for new locations to assist out as well. And with that, I'll turn it back to you. Thank you very much for the opportunity to talk about all the great work that everybody's doing. Appreciate it.
Bear with me just a minute here. I'm trying to get queued up for our media time here. So at this time, I'd like to go ahead, and we're a little ahead of schedule, and that's okay today. I'd like to go ahead and invite our media person, Zaz Hollander from Anchorage Daily News, to go ahead and start with the Q&A, please.
Oh, great. Thank you, Lenine. I have several questions, but other reporters might ask some of them. So I'll just start with one, if that's okay. I was intrigued by the Tok resident that you guys were referencing, and we reported her case yesterday, but I'm just wondering, when travel was mentioned in her case, does that mean she traveled to Fairbanks? And also, how was it known that she wasn't, masked and social distancing? Was that information from the TCC clinic folks or from her? And also, how many people does it sound like she came in contact with?
I'd like to ask Elizabeth Burton to respond to that, please.
Hi. So as far as particulars about any person with COVID, I'm speaking in general terms. I'm not at liberty to talk about where a person might have traveled or who they might have been in contact with. That's part of a confidential conversation with any of the folks that we've been working with over the last 6 or 8 weeks regarding COVID diagnoses. I can tell you that the public health nurses are the ones that do all the contact tracing in the state, more or less. And we are very adept at receiving the referrals and locating affected individuals very quickly. We did a time study recently where we were able to identify that we're able to contact 71% of new affected case individuals within 30 minutes. And then from there, we start educating them about how to stay safe and how to protect their community, other household members, other people they might have been in contact with. One thing I'd like to add is I frequently get questions about, I went to the grocery store or I went to this gas station and I heard there was someone with COVID in my community. Could I have picked up COVID myself at the gas station or the grocery store? And the one thing I'd like to get out there is that when we're talking to a person that's been diagnosed with COVID, we are very careful about finding what their activity has been like over a certain period of time. We go back and talk to them about their activities 2 days before they became ill. And then that's the beginning of when they're infectious. And we very carefully go back and identify anybody that they've been in contact with for 10 minutes or longer within 6 feet or less distance. So I tell people, if we haven't contacted you, you probably are not a high risk contact because you haven't been near that person for more than 10 minutes and within 6 feet of them. So if you've been passing them in the grocery store or you used the gas pump right after they did, as long as you're washing your hands and you're not putting your fingers on your face after you handle a high touch surface like a gas pump handle, you are low risk and we probably won't be contacting you. So in other words, if you don't hear from us, you're probably just fine.
Sounds good. Thank you. Zaz, did you have any follow-up questions?
I don't have follow-ups on that, Lenine. I have a couple questions on totally different topics. I have one question, I guess for the borough, just making sure whether the borough is planning to reopen any businesses, you know, bars, gyms, theaters on Friday, or still waiting for guidance from the state. And then also this big PPE shipment that the state got. I'm wondering what the borough requested and when you expect that to arrive.
Lenine?
Mayor Matherly, go ahead, please.
Well, in response to Zaz, the governor's mandates come out tomorrow. So yes, businesses will open. It's nothing I need to really approve them to do. So whoever's listed in that mandate, and there's a really good synopsis of it that I shared this morning on my social media page. It talks about how you can increase. So yeah, we will see gyms doing 25% and others, I'm sure. So it's not really an approval I'll put out. I've been going by the governor mandates just on the city side, just to clarify.
I've got two more folks that I'd like to have respond to that. And one of them is my chief of staff, Jim Williams. Jim, I think you're online. Would you like to respond to that as well?
Sure. So from the borough's perspective, we heard Governor Dunleavy's press conference last night, and we're anticipating the actual written guidance anytime now, if he hasn't already issued it. But yeah, we are looking at doing a soft reopen on things like at the library. So it won't be a whole bunch of people going into the library. We'll do kind of a book service delivery kind of thing. We're still sorting that out. We're looking at pools right now. A couple of our pools are drained empty because they're under maintenance. They're having maintenance done on them right now. So that's kind of obvious. We're not going to be able to use those. But you know, that what is obvious is even though the pools may be able to open, we still have to maintain social distancing. We still have to be careful and mindful about how we're behaving as a community and how we're allowing the disease to kind of pick up and spread. Things like keeping locker rooms clean, keeping shower areas clean. Those are not all trivial matters when you're dealing with the public. So we're evaluating that right now, but our intent is, to the best that we can, we're going to open up some services.
Thank you, Jim. I'd also like to ask our incident commander, Clint Brooks, would you like to respond to that as well, specifically regarding the PPE order?
Yes, ma'am. So I know that there was, and I use the term rumor loosely, that the state received a $3 million shipment of PPE. We have not heard that through official channels. And we have several pending requests for PPE that have not been received or updated on the situation from the state on PPE. So I'm unaware if this PPE order that was supposedly received is true or not. So we continue to ask on the status of PPE, but we're not getting any results from those requests.
Thank you, Clint. Zaz, did you have any other questions?
No, that's the last question. I did have a follow-up for Clint. So are you asking the state about the PPE and just not hearing back, or are they saying we're still trying to figure out what we've got here and we'll get back to you, or something else?
No, we are not getting any. We're not getting any updates on the status of our outstanding requests.
Okay, thank you, Clint. How much do you have requested, or is that hard to pin down?
I could maybe get you that information, but I don't have it right here at my fingertips.
Okay, thank you very much, all of you, for humoring my questions.
All good. Thank you, Zaz, very much for participating. Now I'd like to turn it over to Robyne from KUAC, please. Robyne?
Thanks. I was going to yield some time to Zaz because she was on a roll there, but maybe we'll get back to her. I have sort of a generic question to Clint, and I don't know if Shelley Ebenal is around, just in how the emergency room at FMH is these days. Are people who should be showing up at the ER with arrhythmias or sore muscles or twisted joints not showing up? I mean, I actually don't know how you would know that, but are the typical cases for the ER down during this time?
So our census in the emergency room was down. We've seen a steady increase over the last few weeks. We're still a little bit down from our normal census that we were seeing pre-COVID. So I'd say that the people that are having urgent and emergent issues are coming to the emergency room. They are receiving the treatment that they need. I don't know why we've seen a decrease. I think possibly that, with people sheltering in place and not being out and doing things, a lot of those accidents that occur or those sprains and breaks don't occur, less people on the road, less motor vehicle accidents. So I think that has a lot to do with some of the lower census numbers in the ER, but we have seen an uptick and we're getting closer back to normal census numbers.
And I see Dr. Nace at the podium. Dr. Nace, would you like to respond to that as well?
Yeah, this is Dr. Nace. I wanted to respond on the question that Robyne had regarding the number in the emergency room, and also put it as a concern that we have as the medical providers, that has been a hold on some patients in getting the medical care that they need. When COVID came to town, a lot of people delayed medical care, and we want to make sure that these medical concerns do get addressed. The medical practices have made a lot of practice changes, a lot of improvements, and a lot of adjustments so that people can safely get their medical care they need in the outpatient setting as well as in the emergency room. So one of the things that we want to make sure that people are assessing their needs, and if they have put their healthcare on hold, this is a time to reach out to your provider in their setting and find out what the next best step is. That might be answering questions by the phone, that might mean telemedicine, or that might mean in-office care that they can receive. And regarding how they're doing the inpatient care can help them determine the next best step that they need to take. So what the shout out is if patients out there have been putting their healthcare on hold, this is the time to contact your medical provider to see how can those needs be met, because we don't want to see other general healthcare be delayed when it is needed at this time.
Thank you, Dr. Nace. Robyne, any follow-up questions?
No, that's pretty good. I was going to ask about whether you thought it might be fear or whether just it's courtesy of people avoiding seeing their doctors to make room for COVID surges. But I don't know if I would have to interview individual clinicians about their discussions with patients and get inside patients' heads. So unless Dr. Nace has any insight into that.
Yes, Dr. Nace, go ahead, please.
So I think it's multifactorial. I think that one, families and community members have heard stay home, stay home, stay home, and they have. They've put some of their medical needs on hold by choice, that's saying this can wait until later time. Also, with not having school, with not having people go to work, with not having people out, there's less transmission, not just of COVID, but of other viruses and diseases that normally are passed this time of year. Also, them with not going out, not having sporting events, there's less kind of accidents that happen. So I think it's a combination of all those things. Also, there is some concern with going to the medical offices because they're concerned, could I get COVID at that time? And right now, there are so many precautions and screenings that we are taking to make sure that patients are safe. When you walk into an office, you're going to be screened, ask questions to see if they can make it to the next step that says that you are not experiencing symptoms that might be consistent with COVID. In order to get into the building, you need to be able to answer those questions in a way that doesn't put the staff or other patients at increased risk as well. If you do have those kinds of concerns, then you are going to receive your care in an alternate setting that still provides you the care, but it provides one that can be both safe for the patient, other patients, and the providers. Things like utilizing your car as the waiting room or going directly into an exam room. The extra precautions also include everybody walking into the building is wearing a mask. We are doing upgrading on the environmental cleaning, how often everything is cleaned. And we're also using barriers that help protect you from the patients, from the people who work there, as well as from other patients. So there are multiple precautions that are being put in place so that patients can feel safe, that their needs are going to be met in the safest possible way we can do it in the office setting. Does that answer your question, Robin?
It sure does. Thank you so much.
Yep.
Robin, any other questions?
No, I'll pass for now. Thank you.
All right, thank you. Now I'd like to turn it over to ERIN McGroarty from Fairbanks Daily News Miner, please. ERIN?
Hey, thank you. I have a question that is likely directed towards local leadership. We're hearing from some businesses who are technically allowed to open that they're either concerned to open for fear of risks, or they feel like it might not be worthwhile to pay for increased operations when they're only allowed a certain percentage of capacity. Is there a response from local leadership as far as a message you might have for those businesses?
I'd like to turn that over to City of North Pole Mayor Michael Welch to respond first, and then City of Fairbanks Mayor Jim Matherly. Mayor Welch? Mayor Welch, we cannot hear you.
Can you hear me now?
Yeah, we sure can. Go ahead, sir.
Can the question be asked again, please? Go ahead.
Yeah, so we're hearing from some businesses in town that while they are technically allowed to open, they're feeling concerned about taking that step, or they are feeling like it might not be financially worth it to pay for operations while they're only allowed limited capacity. Is there a message for those businesses expressing that concern?
Yes, thank you for that, ERIN. I won't name the companies here or the businesses here in our town, but they have expressed that concern because they felt like the instructions from the state were either nebulous or that they were too restrictive. And I've also understood that some of the businesses that I deal with here in North Pole say even what's being proposed is still too restrictive. So it's not worth their while to bring in back on staff, extra employees, and try to open their business doors because the social distancing. So I'll give you an example of a restaurant that's built to have 120 people in it. And, but if they had to do the social distancing under the current rules, they couldn't get 20 people in there. So maybe the new rules, they might only get 30, 35 people in there. It's still not worth their while. And so they would rather continue to do what they do like they do. Now, our main store in our town, which is Safeway, they actually control how many people come and go out the door. And so they are pretty well opened up at 6 in the morning and they close at 9 at night. They used to close at 1 in the morning. So I don't know how the new rules, because we still haven't seen them in writing, Erin. So I hope that in some way answers you, but I know some places that like have schools, they're being treated as if they're daycare centers, which they're not. They're private schools, and they operate their schools on a year-round basis. So we're trying to get some common sense provisions for them to exclude them from being considered daycare centers, but that they're private schools. And so that could help them. One I know of had 23 students, and because of the restrictions, they went down to 16 students. So instead of having 3 teachers, they had to lay 1 teacher off. So I'm working to get that changed. Thank you.
All right, City of Fairbanks Mayor Jim Matherly, and then we'll be followed by Borough Mayor Bryce Ward. Jim?
Thank you, Lenine, and thank you, Erin, for the question. The message I've talked to a few business owners in Fairbanks have been, you know your business better than I do. There's one particular restaurant that just didn't feel right opening, and this was COVID related, not so much money related for this particular business. They said they were going to continue to do pickup and curbside. And I said, that's fantastic. You're not required to open. I want them to feel comfortable. I want them to feel safe. So my message to them is follow what you think is best for you and your employees. We'll continue to support you with curbside pickup, which a lot of Fairbanksans have been able to do. And if they have specific questions for me to maybe clarify some of those, then please do call me. But that's my message to them, is open when you feel comfortable. And yes, like Mayor Welch said, there have been some that have been frustrated with all the mandates, and they feel they can't invest enough to follow them, so they'll remain closed for a short time, hopefully, and then still do the pickup orders. So thank you.
Thank you, Mayor Matherly. Borough Mayor Bryce Ward, please.
Yes, thanks, Lenine. You know, we've heard a lot from businesses, and there's been a couple things that we've been working on within the Fairbanks North Star Borough. The first one is through our Economic Development Commission. We did just finalize on Tuesday a recovery plan that is actually just went live here about 1 o'clock, and that's available on our main website. And that outlines a couple things that we've identified, several things on a immediate, short-term, midterm, and long-term basis that we can do to start bringing relief and recovery back to the community. Some of those things we've already begun. Thanks to Foundation Health Partners for the business toolkit. We recognize that there's some shortfalls in the guidance the state's given. And so we're doing our best to work with our partner agencies within the community to give better guidance. But ultimately, as Mayor Matherly mentioned, it's going to be up to an individual business owner to decide, one, if they can meet the mandates, and then two, if it meets their business model, to open their doors with the reduced numbers or limited access that the state mandates require. The other thing that we are working on is the CARES Act funding that we have allocated to come to the interior. Both the cities and the borough have an allocation that is awaiting approval by the legislature and the governor. However, we've been working on understanding the guidance given by Treasury and how we can use that, one, to meet the cost that we incur as the Fairbanks North Star Borough as the government, but then two, how we can use that in the best way to provide relief to our businesses. So that's still in development, the overall program and what that would look like. Ultimately, you're going to see an approval package that comes through the assembly as part of an appropriations package to be able to spend those monies, and it'll allocate what portion of that will be used to cover general government costs, and what will be made available, and what those requirements would be for our local businesses. But we definitely have heard from them and understand that there are significant challenges to overcome, even with the state relaxing some of the mandates.
Sounds good. Thank you very much, Mayor Ward. Erin, did you have any follow-up questions?
Yeah, this one might be for our medical experts who are calling in today. Part of the second phase is a plan to open up swimming pools, of course, to limited capacity. But even if you only have a few people in a pool, it seems like water is still moving around. My question would be, how safe is it to open up swimming pools at all, given the assumed kind of germ sharing nature of that facility?
Foundation Health. Yes, Dr. Bruner, thank you.
Yeah, I can take a stab at that. And then Elizabeth, if you have anything to add to that. I think the really sort of reality is that we don't have perfect information on COVID-19, that a lot of these things we're making the best decisions that we have in the moment. And I think in any setting, whether that is a swimming pool or a park or a house, it's going to be the same messages that you've heard us say and you've heard Elizabeth say, which is going to be wash your hands, wear a mask when you can, and stay 6 feet apart. But to my knowledge, we don't have great swimming pool specific information at this time.
Thank you, Dr. Bruner. Elizabeth Burton, I'm not sure if you're still on the call.
I am, and I agree with Laura, with Dr. Bruner. We don't have real clarity around this topic yet, and as soon as we have something available, I will be glad to share it with the Incident Command and with you, Lenine, to disseminate.
Absolutely. Erin, anything else?
Not right now, thanks.
Thank you. Now I'd like to go ahead and turn it over to our television media partner, RAMZI ABOU GHALIOUM. Are you still on?
Hello, yes, thank you. This is Jordan Rodenberger in for RAMZI, and I did join late, so I apologize if this was addressed, but this is in regard to the Carlson Center as an alternative care facility. I was wondering if there was an update on that or an update on any of the future plans regarding the Carlson Center as an alternative care facility.
I'd like to ask our Incident Commander, Clint Brooks, to respond to that, please, regarding Carlson Center.
Yeah, so right now we're got it in a warm ready status. It's fully set up, ready to go. We plan on reevaluating whether to keep it set up at the end of May. We want to see how this phased opening approach is going to affect our numbers. And we don't want to close the Carlson Center too early. We do have a demobilization plan and been working that. So we're going to reevaluate that at the end of May and make a decision whether we need to keep it open further. The state does have a contract for the Carlson Center through June, but we can always terminate that early. So the numbers will be our guide, and that decision will be made at the end of the month.
Thank you, Clint. I'd like to go ahead and ask Borough Chief of Staff Jim Williams to go ahead and speak to this too, please.
To the Carlson Center?
Yes.
Yeah, so right now the agreement for the management agreement for the use of the Carlson Center for the event is between the state of Alaska and the operator of the Carlson Center, SMG Global. What we're doing at the borough is we provide basically the facility maintenance and the provisioning of the facility, but the operating piece of that is between the state and SMG, and we're kind of taking guidance from Foundation Health Partners and kind of responding to their needs and help facilitate that. So, you know, from the borough's perspective, if whatever they need, we're going to help them get that taken care of.
Jordan, does that answer your question?
That does clarify it. Thank you. That is all from me.
All right. Well, I know several of our partners have to finish up with this meeting a little bit early today, so we're going to go ahead and wrap up. I would like to remind everyone that we are recording this press conference today, and unfortunately, this is the last one that we have on the schedule right now, as things have been going very well with the community's response to COVID-19. So we will not hold another press conference unless something should happen in the community. We'll keep our fingers crossed that that won't happen. I would like to take this time to thank everyone who has participated in the press conferences over this last month. A special thanks to all of our elected leaders, our partners at Foundation Health Partners, our community partners as well. And we just want to remind everyone to please continue to follow the health mandates as they've been outlined. We want to continue to keep the curve flat, as they say. Yes, this is a new normal that we are experiencing. We are Alaskans, we are resilient, and we will continue to work through this. So with that, I'd like to go ahead and wrap up the press conference. Again, thank you everyone for your participation today. And after we wrap up, we will get this recording uploaded on the Borough website and shared with our partners as well. So with that, thank you very much and have a good afternoon.